This video talks about a specific antifungal called flucytosine. But before we learn any drug, we have to learn a system of how to handle all the drugs in that category. So I will do a very quick overview of all the different kinds of antifungals that's out there, and then I will talk about specifically about flucytosine. Now, at the level of the cell wall, there's three different ways that antifungals work. There is one which is going to make holes on our fungal cell membrane and cause leakage of the electrolytes, and that kind of drug is amphotericin B. There is the other type, binds to a protein called ergosterol and disrupts this protein, as a result causing fungal membrane damage. So it binds to ergosterol, disrupting the fungal membrane damage, and those drugs are called nystatin, or that drug is called nystatin. And the third type that works at the level of cell wall is by inhibiting a protein called beta glucan. And when beta glucan is inhibited, that drug is called caspofungin. So the first type makes holes and allows leakage of the cellular contents, and that is amphotericin B. The second type inhibits ergosterol and therefore disrupts the fungal membrane, and those drugs are nystatin. And the third drug is it inhibits a protein called beta glucan, and as a result inhibits fungal cell membrane synthesis. So these are the three types of drugs that works at the level of the cell wall or cell membrane. But what about the ones that works inside? Okay, so let's talk about those. Now, inside the fungal membrane, we have, inside the fungal cell, we have a protein that is called squalene. Squalene is converted to lanosterol. Lanosterol is again converted to ergosterol. Okay, and squalene to lanosterol, the enzyme that converts squalene to lanosterol is squalene epoxidase, and this is inhibited by the drug terbinafine. Okay, terbinafine inhibits squalene epoxidase, which prevents the conversion of squalene to lanosterol. But what about lanosterol to ergosterol? This pathway is metabolized by P450, or P450 converts lanosterol to ergosterol, and the drug that inhibits this particular pathway is going to be the azoles. Okay, those are the ketoconazole, fluconazole, itraconazole, voriconazole. The azoles is going to inhibit that pathway. Okay, so we talked about three at the level of the cell wall, and then two at the level of protein synthesis. What about DNA synthesis? Okay, so pyrimidine synthesis is inhibited by a drug called flucytosine. Okay, so this is where our flucytosine comes in. What it does is, so I'm going to talk about the mechanism of action here. So what flucytosine does is, flucytosine is going to inhibit DNA synthesis. And how is it going to inhibit DNA synthesis? By converting the nucleotides to 5-fluorouracil. Okay, so what's going to do is it's going to convert the precursors into 5-fluorouracil, and it's not going to be making our pyrimidines. And this is achieved by, so let's say there is a precursor here, and it's supposed to be converted to pyrimidine, but instead of doing that, it's taking a separate pathway to be formed into 5-fluorouracil. And this enzyme, which converts it into 5-fluorouracil, is cytosine deaminase. Okay, cytosine deaminase. So that is a mechanism of action of 5-fluorouracil. It inhibits DNA synthesis by converting nucleotides to 5-fluorouracil by using the enzyme cytosine deaminase. Now, what about the clinical use of flucytosine? Usually it's used for systemic mycosis, and it's used in combination with amphotericin B. Okay, it's used in combination with amphotericin B. Some of the examples that we can see this with is Candida and Cryptococcus, to name a few. Now, these are the clinical use of flucytosine. What about toxicity? Okay. Now, we already know that flucytosine is a DNA synthesis inhibitor. So, would it be fair to say it's going to cause bone marrow suppression? Not really. Other associated symptoms is going to be nausea, vomiting, and diarrhea. So let's do a quick review. So flucytosine, so again, flucytosine, F for flucytosine, F for 5-fluorouracil. You can remember like that. And it is going to convert our nucleotides to fungal nucleotides to 5-fluorouracil using the enzyme cytosine deaminase. Okay, and it's going to cause bone marrow suppression, nausea, vomiting, diarrhea as some associated symptoms. It's not going to form pyrimidines. Clinical uses are going to be systemic mycosis like Candida cryptococcus, and it's used in combination with amphotericin.